But we want to also look at the risk factors, or what predisposes one to suffer or experience high blood pressure. The first one, obviously, is age. The older you go, the higher the risk for you to suffer from high blood pressure. The second risk factor is family history, which can also then be linked to genetics. So if you do have a relative, an immediate relative that suffered or that is suffering from high blood pressure, you are also at risk of suffering from high blood pressure. So immediate family members include father, mother, brother, or sister. If any one of them had or are suffering from high blood pressure, you are also at risk of suffering from high blood pressure. The next risk factor is the issue of tobacco smoking. Those that do smoke tobacco are at high risk of suffering from high blood pressure. The other risk factor is alcohol abuse. Those that do drink, especially excessively, they are also at risk of suffering from high blood pressure. Then the other issue is the issue of physical inactivity or lack of exercises, which we are now finding quite prevalent in our setting, because people are no longer exercising, neither taking long walks, because from one's door they get into their car or a short distance into a combi to the next destination and into their office or home. So an increased sedentary lifestyle increases the risk of suffering from high blood pressure. Then the other risk factor is obesity or overweight. When one is overweight or obese, the risk of suffering from high blood pressure also increases. But maybe just to define in terms of overweight and obesity, if you do take your weight and you measure your height, and then you calculate what we refer to as the body mass index, if it is above between 25 and 30, that is overweight. When it is above 30, you are now obese. So obesity increases one's risk factor of suffering from high blood pressure. And then the other risk factor, again, that also predisposes one to high blood pressure is high intake of salt. Many people have a habit of, as soon as food is served, they take a salt shaker and then they just put salt in their food, even without tasting. So high salt intake actually also increases your risk of suffering from high blood pressure. These are some of the risk factors that increases one's risk of suffering from high blood pressure. Please visit any of our Vivat healthcare clinics near you to get your BP checked for free, and Vivat healthcare clinics will extend free BP checks to the end of June. Thank you.